And now, Deborah Kobylt Live.
Thanks so much for that, Kurt. And thanks everybody for joining me today on Deborah Kobylt Live. And I have on the phone with me today, Dr. Abe Malcolm. Dr. Malcolm is a high-end, on-demand, personalized doctor. He'll come to your home. He's been doing that for a few years. But during this time of COVID-19, he's been busier than ever, offering house calls, does telemedicine consultations, vitamin drips, anti-aging, I'll take it, lab tests, cosmetic treatments. And I love the lab test part, doctor, because I'm going to be giving you a call because I'd love to get a COVID test. I haven't been able to do that yet. Thanks for joining us.
My pleasure speaking with you today. Thanks for having me.
Yeah, it's very exciting. Tell me a little bit about your business since COVID-19, where most of us just aren't going to the doctor.
Sure. We set up an infrastructure a few years ago when I started my practice to provide, personalized, customized medical care at home for people. And, this has been attractive for people for the last few years who really want to take a proactive approach to their health. But now, with society being quarantined, people are looking for options to receive care at home, not wanting to go out and put themselves at risk, perhaps becoming infected by others. So our in-home COVID services have been very popular. We offer routine medical care, urgent care visits, in-home COVID testing. We offered the swab testing initially in March and February when people were actively sick. And now we're doing a lot more antibody testing, trying to help people determine what their infection status is. Did they have the infection in the past? They had a cough or a cold in January, February. What was that? So we offer a range of services in home.
That's great because as I think I told you earlier, I personally don't want to go stand in a line in my car and see a stranger and get tested. The whole situation just sort of gives me a little bit of anxiety. So knowing that I can have someone come to my home personally, quietly, and give me a test and then off you go is of great comfort to me, I have to say. How are you able to get all these tests though? I mean, are they readily available to you?
Yeah, that's a really good question. Earlier on, swab tests, which were the diagnostic tests we were using in the last few months, were very difficult to get. I'm sure you heard on the news all of these shortages, both at the government level, at the large corporation level, and for people like me, individual practitioners who had to negotiate with labs to get swab testing. That has since changed a little bit. Now we're doing more antibody testing, and there's over 100 companies producing antibody tests. They've all submitted applications to the FDA for approval. Only a handful have gotten approved thus far. So the landscape of antibody testing is changing every day. We have good relationships with labs that we trust that are supplying us with our current supply. But as new testing becomes available, we're constantly shifting our focus to the next most accurate, most effective test on the market.
I have to tell you, telemedicine to me is fantastic because I'm one who will not go to the doctor because the thought of suiting up, parking, waiting in the waiting room, then sitting in the room, my whole day is gone and it's just too much for me. And then when he comes in, he goes, you're fine. Do you know what I mean? I'm not sure why we haven't been doing this decades sooner. I mean, right? The whole telemedicine
yeah, I think wrapped into that is, the concierge level of care. Like I talk to my patients on a weekly basis. I certainly don't see them in person on a weekly basis, but having that rapport with patients where the barriers of communication are lowered. So you feel comfortable talking with your doctor, not just when you're sick, but even when you're healthy and just looking for advice and guidance. That's a super important aspect of medical care that we really don't have in our current model. You really only go to your doctor once a year for your annual physical, and then maybe once or twice a year when you're sick, but you don't have an alternative to interface on a regular basis. And that's really what telemedicine offers. It's a way to feel comfortable talking with your doctor on your schedule.
I love that about also what you offer, because what you offer is you can even have a monthly plan. Remember, we talked about that. And I could call you every day if I wanted to. I mean, that's a great comfort. There's many different levels of care that you offer, correct? Depending upon what your patient needs.
Yes, typically what happens is patients will call me for an acute visit. They have a cold, a cough, a flu, COVID, and then they'll experience care with either myself or one of the other doctors that I work with. And they'll say to themselves, wow, this was, like you mentioned, a lot more convenient than going to my doctor. what else do you offer? And then they may utilize some of the other services like IV therapy, cosmetic procedures, anti-aging medicine. And then once they realize how beneficial it is, then they end up signing up for a concierge membership. So they're just part of the program and have access to all of the services that we offer.
Let's talk a little bit about the services that you offer. Number one is lab testing. I want to get into that a little bit. You know, you feel like you're sick. Maybe you diagnose someone and say, well, it could be this. Let's take some blood. So you offer a myriad, right, of testing, just about anything out there, right? Can you tell us about it?
Yeah. So, we offer the traditional lab tests that you would get through your doctor's office, cholesterol, blood sugar, electrolytes and such. But going beyond that, we really take a more holistic view of the patient, and we try to do a battery of tests that really get to underlying issues. So for example, one of the tests we offer is a food sensitivity test that you probably wouldn't get from your normal doctor because it's not something that's typically covered by insurance. This helps you understand the areas in your body that may have inflammation due to food sensitivities, not necessarily allergies, like shellfish or lactose, but actually just minor insensitivities that cause inflammation. Another example of testing that we offer is cortisol level testing. Cortisol is an enzyme in your body that causes inflammation and really is created by stress, especially now with all the stuff that's going on. So we try to give you a whole picture of your health, not just on the parameters that are typically tested, but on a much more holistic view of your body.
That's so important. I'm going to use myself as an example. Okay. I've had some inflammation because I had a knee injury. And on any given day, it's there, it's not there. It could be a myriad of things. That's why I'm going to sincerely do this with you, because some of the testing you offer, as you said, they won't go there at the doctor's office. They just take a look and go, no. And I just think it's very complicated, the landscape of our bodies, right? And just what's going on in there. And as you said, the whole approach, a holistic approach, is so important.
Yeah, now everyone talks about keeping a healthy immune system, but what does that mean?
What does it mean?
Times have you talked to your doctor about keeping a healthy immune system? Usually you talk to your doctor when you're sick. But what do you do when you're healthy? So there's really three main areas that you need to focus on. So one, as I mentioned, is lowering inflammation. A lot of that is through your gut. People don't realize your gut is super important to your immune system. So avoiding foods, toxins, foods by which cause insensitivities will lower your overall inflammation. The second is sleep. People, burn the candle on both ends and aren't getting enough sleep. Sleep is super important to repair at night to have a healthy functioning immune system. And then, supplements like vitamins, zinc, vitamin C, glutathione. These are things that remove toxins from your body and ultimately support a healthy immune system.
I love that. And the sleep, as you know, is important, but I'm someone who doesn't get enough, because as I'm laying there, I'm thinking about what is going on in life. You know what I mean? And I know that you also help people with that, with anxiety, which is so important. It's all related, everything that's going on with our bodies. And it does seem to be more prevalent now than ever, because we have so much coming at us right now, more than ever. Don't you think?
Certainly mindfulness, and it's, was on the fringe, 5 or 10 years ago, but now it's really in the forefront with all the apps that are coming out, helping people with mindfulness and dealing with anxiety in a non-prescription way. I mean, that's my first choice, is always to choose something more holistic than a prescription. And, now, unfortunately, a big part of my practice is addiction medicine. Given the stress that people are under and the fact that they've had to quarantine, I am seeing a lot of my patients unfortunately go through relapse during this quarantine, and we're having to deal with the underlying issues and help them, maintain good habits. So it's really easy to fall into bad habits when you're quarantining and you want to have a glass of wine at night, which is fine, but really knowing your limits is super important, especially during this time.
What's important about that is I know that you offer addiction help and treatment at home. So talk to me a little bit about that, because that's not so easy either.
Picking up your life and going to a treatment center is a huge decision to make, especially now with all concerns about COVID. Being in a house with multiple other individuals, you're putting yourself at risk. So what we do is we bring those same services to the home. So if you're struggling with addiction from alcohol or pills or whatnot, we can have a nurse stay with you at your home, monitor you 24 hours a day, take your vital signs, help dispense your medications, and do a safe addiction recovery service in the comfort of your own home.
Let's talk a little bit about the drip. What is that? Because a lot of times I'll walk by a business and it's like, oh, drip services. I've never gone in. Tell me about that. I know it's very popular.
It is popular. And I'll give you some history here. So about 15 years ago, there was a doctor in Las Vegas who had a bus called Hangover Heaven. And he would drive around.
Wait. What was that called?
It was called Hangover Heaven.
Oh, I love that.
He would drive around to all the hotels, picking people up and taking them for about an hour ride, putting an IV in, and then dropping them off back at their hotel. So that's how the whole notion of drip therapy became popular. Now, more so, people are using drips not so much for recovery, but more for wellness. So people that work busy hours, travel a lot, they're getting vitamin infusions to help with their immune system, maintaining a healthy immune system, maintaining good energy level. So it's moved more from a recovery to a wellness solution for people.
How is that better than just popping a vitamin?
Great question. So when you take a vitamin, it has to travel through your mouth, down your esophagus, into your stomach, get digested, and then be absorbed into your bloodstream. During that process, you lose about 80 to 90% of the actual nutrients of that vitamin. But when you get an 100% of it goes into your veins, which eventually is absorbed into your bloodstream.
What's the number one vitamin that you think is very important to be taking daily and to be injected?
Maybe three instead of one.
Please.
So the most important, I think, is vitamin C. Vitamin C has a myriad of benefits, but its main benefits now is that it's a strong antioxidant, meaning it travels through your bloodstream, flushing out toxins, and it actually has been shown to be extremely helpful in improving your immune system and fighting viral infections. In addition to vitamin C, glutathione is another really powerful antioxidant, which is difficult to get in, general nutrients, which is why people often get either injected intramuscularly or via IV. Those two are the top two antioxidants that we typically find in IV infusions. And then zinc, which is an oral supplement you can take, also, again, very helpful for boosting your immune system. So those would be my three most important vitamins to be taking right now.
Do you offer a cocktail where they're all sort of in there together?
We have a super immune boost cocktail that we offer right now, which has been very popular. Like I mentioned, most of my patients take a very proactive approach to their health. So they've been doing this not just during COVID time, but throughout the year to maintain a healthy immune system. And I think that's the message for people is, we got through the worst of it to some degree, but this may reoccur again in November, December. So we have the next 6 months now to really prepare ourselves, doing all the things we're talking about to make sure that if this does happen again, we're better prepared.
Yeah, no, there's no doubt about it. And I ask you these questions because this is something I'm interested in that I haven't done. And I just think, why not? I mean, this is just, it makes all the sense in the world to me. And again, instead of going to one doctor for one thing, you take care of the whole body, the whole person. Do you mind if we get back to inflammation for just a moment? Because we were talking about that earlier. What does that do to the body, inflammation? You hear about it on commercials half the time, right? But it's something that I personally have developed, and I want to know, what else does it do to the body other than the area that's inflamed? Does that make sense?
Yeah, great question. So let me give you one example, and it ties to your gut like we talked about before.
Yeah.
The lining of your intestines has a whole myriad of cells which are extremely important to your immune system. When you have inflammation in your body, those cells get dislodged or disfigured, and now you're not able to absorb nutrients as well and convert those nutrients into a properly healthy immune system. In addition to that, inflammation throughout your body affects cellular function. So in your brain, in your kidneys, in your liver, inflammation reduces absorption and causes proliferation of toxins. So without getting too technical, inflammation is really the root cause of a lot of the disease processes in our body.
How do you get that under control?
Yeah. So
other than foods, I mean, it's got to be a combination of things, right?
I would say, again, there's three ways really to deal with inflammation. One,
three is your magic number. There's no doubt about it. There's three.
Yeah, natural propensity toward threes. But yeah, as I mentioned, food is one of them. Number two is sleep. Sleep is really important because your body repairs during sleep. And then the third is reducing stress levels. So mindfulness, like we talked about before, whether you use a meditation app, whether you exercise, something that helps reduce your cortisol levels, increase your endorphins, ultimately leads to much better a reduction in inflammation.
You were also a little ahead of the curve on regenerative medicine. Can we talk a little bit about that? And you come to the home for that, which is incredible. Let's talk.
We really want to bring our full suite of services, both medical, regenerative, addiction to your home. So some of the really popular services now, we're learning a lot more about things like, I'll give you a couple examples. I'll give you three, actually.
Three? I was going to say, you're going to give me three? I'm enjoying this.
So number one is NAD. NAD is an enzyme that your body produces naturally, but as you age, beyond 35, 40, your body produces less and less NAD. NAD drives cellular function at the mitochondrial level. So anytime your body needs to produce a chemical reaction, whether it's producing more proteins, more neurotransmitters, it requires NAD to cycle through. It's difficult to get orally, and it's not very bioavailable with the foods that we eat, which is why patients are now getting NAD infusions to essentially replete their levels. When you get an NAD infusion, your body, it's almost like putting gas in a car. Your body starts revving up its engine and utilizing that to produce all the things that it's been missing. So really important. You can get it orally. There are supplements that offer it. However, unfortunately, it's not very bioavailable orally. So it's much better absorbed either intramuscularly or IV. That's the first one. And if you have questions beforehand, I can go on to the others.
I do. When you inject the stem cells, again, do you do it muscularly? Is that more effective? Let's talk about me again. The knees. Let's say you were inject something in the knees to help with inflammation there. Is it better to do that or just to go throughout the body straight into the bloodstream?
And you bring up stem cells. That was the second one I was going to talk about. Really point. Stem cells are embryonic tissue that is immature, that hasn't differentiated yet, that has the ability to become any cell in the body. So let's say you have knee pain and you're missing cartilage in your knee. If you inject stem cells directly into the knee, those cells will then become cartilage cells in that area. Now, if you have multiple joints with issues, knee, back, shoulder, you can infuse them via IV, and then they travel throughout your body and regrow tissue in multiple. So I tell people, if you have one joint that's bothering you, get an injection into that joint. If you have multiple joints or multiple areas of your body, get an IV infusion.
Interesting. And you were going to go to number three.
Number three is peptides. So this is, and again, this is a lot of information. But I recommend that patients talk to their doctor, get more information because there's so much out there. But peptides essentially are amino acid chains. They're precursors to protein that trigger cellular functions in your body. So for example, insulin, which a lot of people have heard of, is a peptide. It tells your cells to uptake sugar, uptake glucose, and lowers your blood sugar. But there's about 200 peptides that are naturally occurring that, again, as you age, you produce less and less of them. So one peptide, for example, which I recommend to my patients, is a peptide that helps your body naturally increase growth hormone. So it's an alternative to taking steroids or all the other testosterone, all the other things that can hurt your body. This is a natural way to do it. So as you age, you can maintain muscle mass, maintain energy, and have all the benefits that you had when you're younger as you age.
This is great. I mean, when you come to someone's house, you initially, right, talk to them about all this to just give them an option if this is something that they want to do. Again, other than just stick out your tongue and go, right? I mean, it's just...
The beauty of an in-home visit is that I'm not rushed. I don't have a list of patients back to back. I can spend as long as I need with the patient. And, a lot of these are based on your goals, your current symptoms. So I need to fully understand where you are, what your goals are, and then I can put together a plan that really meets all your needs.
I love this. I love this whole approach because it's something, as I said, I need. Please. What do you do? You've got regenerative medicine, all kinds of medicines for anti-aging, right? Talk to me about it, including, I guess, coming and doing the usual stuff that people are doing, right?
So some of the stuff we just talked about, the NAD, the stem cells, the peptides, those all fall within regenerative or anti-aging medicine services. Obviously, we do offer cosmetic services like Botox, facials. We actually offer PRP or stem cell facials for patients. So this is a way of taking those really important growth factors in cells and injecting that directly into the areas where you need the most regeneration. So like I said, we like to heal from within, but for patients who want it, we can also heal from the outside as well.
That's great. Tell me a little more that I don't know about, that I didn't even know to ask you, that you offer out there. I mean, do you have a menu? I'm sure you do on your website, right?
Yeah, and it could be overwhelming for people. Most of the people start off with a regular house call for, some kind of urgent care issue. And then I slowly involve them in all the other services that we offer. But again, the goal here is really to have people see this not as a sick care model, but as a wellness model. So we want to put together a plan for you that will keep you healthy so that when the next COVID-19 virus comes out, they'll be ready and they'll have a healthy immune system. They'll already be practicing the types of routines and behaviors that will keep them healthy.
Yeah, I mean, you've got me as a patient. I'm absolutely signing up. I think this is terrific, something I've needed. But why is it that doctors haven't been doing this sooner? It just seems like a more sensible approach, not just for us as a patient, but for you as a doctor. Get out, got your little bag with you. You know what I mean?
There's probably two reasons. There's, one is, I'm outside of insurance, so I don't take insurance. Most of the services that I offer are not covered by insurance. So, you have to be willing as a physician to market yourself, to justify the prices that you're charging. I think most doctors are not inherent businessmen. Luckily I got an MD MBA when I went through medical school. I got an MBA also, so I had some familiarity with running a business,
right,
myself, which that's a big part of this practice. For most doctors, they just punch in, punch out, show up to their job, are great clinicians and really serving a greater good, but they don't want to be involved in the business end of things. For me, that's part of the excitement of the job, is to help get out there, talk about this products that I offer, help people, but essentially run a day-to-day business as well.
You know what else I think is very valuable? To know how someone lives. You can go sitting on that cold table and you could tell a doctor something and he has no idea what's really going on in your home, right? But if you walk into someone's home and you can immediately feel what might be happening, I think that's got to be half the battle right there, right? You can help treat someone when you understand them better, right?
I'll give you a story that illustrates that. I have had who I saw, been seeing for at a hospital setting for a while, and then I actually converted him over into my practice, and I did a house call for him. And when I walked into his home, I could smell immediately the smell of cigarette smoke, and it led me to believe that this wasn't someone who smoked once in a while, occasionally, but he was a 2-pack a day smoker, and someone who had respiratory issues, that's obviously the underlying cause. Other times you see scenarios where children who are getting sick frequently, you realize, there may be mold toxicity, there may be allergens in the air that are causing inflammation in their airway, leading to a poor immune system, to recurrent infections. These are things you would never be able to notice in your office setting. So it is actually gives you another insight into the patient. And plus, people are much more at ease at home. The amount of they share with me, they feel the level of comfort they feel. No one likes being on that white paper in the doctor's office waiting. You're already frustrated because you've had to wait for an hour. The exam lasts 8 minutes. This is a very different experience.
I'm going to tell you something very personal. My knee was really hurting because I had an injury, and I went to a knee doctor in the past year, and I was crying because I was scared. I don't really like going to the doctor, I'm telling you. And I was in pain. And when he walked in, he said, "Are you sure you don't need a therapist or a knee doctor?" And I thought, whoa, that was out of line. And I thought, I couldn't even believe it. Needless to say, I won't be going back because I was very anxious. And that's certainly not a whole approach, to what might be going on with someone who's not feeling well, right? Hence my point to being able to come in a relaxed environment where someone is just, feeling more at ease. So this is great. I'm surprised that there hasn't been more of this. So I'm grateful that you're doing this for people. Tell me, if people want to get in touch with you, particularly now, and they want a COVID test, especially the antibody test, how do they get in touch with you? And is it really that simple? What's the test like to get the antibody?
There's 2 different options for the antibody test. One is a rapid finger stick test where we send myself or one of my nurses to your home. There's a finger prick where we draw a little bit of blood, put it into a cassette, and then it takes 5 or 10 minutes to get the results. The other option is nurse to your house to draw your blood. We then take your blood, send it to the lab, and we get the results within 48 hours. But either way, minimally invasive, and anyone can do it from their home.
Are they both equally as effective?
Good question. So one involves blood from your finger stick, which is capillary blood, and that is a lower volume of blood than blood you would get from a vein. So theoretically, with more blood volume, you have more opportunities to identify antibodies. So if someone really needs to know, either they want to donate blood or they have a very sick relative, I would recommend they get the blood draw test. But if they just want a rapid test that gives them a general idea, then they can do the finger stick.
Now, you've really been spreading your business, right? How many states are you in now? I know you primarily are out of California,
Correct.
but you're modeled now. You're in how many states?
We're now in 7 states across the country mainly for our IV therapy, which is growing by the month. Our goal is to national infrastructure of on-demand nursing and offer all the services that we talked about in all the 50 states. Start with IV therapy, but then expanding to more of the regenerative treatments.
I think this is wonderful. Also, doctor, where did you go to medical school?
I went to Tufts in Boston. It's a little bit colder than here in LA.
Yeah. So you've got all the degree. You just you're not sitting in an office. Instead, it's in your car and into your home. I love that. Do you have a little black bag?
I do. I'll have to show it to you for the visit.
No, I love that. I mean, it's kind of like the stuff that people did like years ago that you'd see on TV shows, The guy would come over with his little black bag. And I'm glad to know that we're going back to that. It just seems more sensible. Anything else you want to add, doctor?
I just want to, anyone who's listening, let them know that, we did a great job flattening the curve, doing what we had to do to slow this down. But, this may reoccur in the winter season. So now's the time to get your immune system in health. Go to your doctor, develop a good relationship with your doctors, take the right steps so that we don't have to do this all over again.
Yeah. Obviously we should continue practicing the safe distancing. I will. There's no need not to. I'm not in politics, so I really don't know what to say about the way they're opening or not opening. But you're right. We need to sort of stay healthy, right? What are you hearing about any possible treatments or vaccines since you're in the medical community?
Yeah, so there's a couple of treatments that are available right now, actually. One is called remdesivir. That's an antiviral medication that prevents the virus from infecting your cells. That's actually been recently FDA approved and will start to be widely distributed. It can reduce the symptoms from 14 days down to 11 days. So it's not a miracle cure, but it can help reduce the symptoms. There's other medications being tested right now that should come to market in the next few months. That's on the treatment side. On the vaccine side, we're all hopeful we get a vaccine within 18 months, but to be honest, it could take quite a bit longer than that. So I think it's really on us to prevent the spread, and we can't expect a miracle vaccine anytime soon.
Yeah, I've really enjoyed talking to you, doctor. I could keep you on forever. Dr. Abe Malkin, and it's conciergemdla.com, right? That's your website. And that's the best way for people to get in touch with you?
Yeah, we're very good at responding quickly. So feel free to reach out to us, and I'd love to talk to you further.
Really appreciate it. Everybody, please reach out to the doctor. I personally think this is a way of the future with medicine. And I know that I'll be reaching out to the doctor. And I very much appreciate you joining us today. It's very, very interesting. So everybody, please get in touch. If you're looking to get a COVID test, he's got them. Personally, I think it's the best way to go. And there's so much else, just like the doctor said, just to keep you healthy, to keep our cells healthy, to keep us, moving forward at that rate, because you're right. Probably in the winter and spring next year, this is going to have a resurgence, and that's a little scary for everybody. So let's all do our part. Thank you again for joining us, doctor. And thank you again, everybody, for joining us on Deborah Kobylt Live. You can find us on Facebook and YouTube, posting our promos on Instagram, and then all over on your podcast platforms, iHeart, Apple Podcasts, Spotify, wherever you get your podcasts, you'll find us. So thank you very much for joining us, and we'll see you next time. Bye-bye.